Hello, it's Dr. Gay from First Look MRI, and this patient complained of pain in the posterior shoulder, posterior scapular region, but they're worried about all the muscles. They want to look at the trapezius muscle, rhomboids, they want to see the whole shoulder, the whole thing, but the pain was in the posterior aspect, and everything looked pretty good overall, but there was one finding in the posterior shoulder where they had their symptoms, and it was right on one of these views. There it is, a little vertical band of bright signal right here. Again, everything else looked about normal. So let's put up another view. This is a PD fat set sequence. If we put up a T1 weighted sequence, we see the areas right here, the little triangle with a little bit of fat within it. And that's where it was. It looks like maybe it has some little fatty elements and some little vessels or maybe fibrous material centrally. Hard to tell in this T1 weighted sequence. Let's put up a PD fat set sequence now. So here's that same region. If we go down to it, there it is. So pretty bright in the PD fat set sequence. A little localized area there. And this is a sagittal PD fat set sequence. And here we have the ribs and chest wall. And then here is the scapula. And this little foggy area of brightness is right here, very small. So coming back to this, this is best seen on the axial PD fat set sequence. We have a localized process here. Looks like a little localized inflammatory pseudomass along the medial margin of the scapula, inferior medial margin, and it's right over those ribs. So this is a classic location to have an Elastofibroma Dorsi, which is an inflammatory pseudomass. I think it may be related to rubbing of the scapula, medial scapular border along the ribs here, and in this region you get an inflammatory response. It has some fatty elements and fibrous elements, and again they call it this Elastofibroma Dorsi. Now the things that don't fit here, this is a young person, I think they're 29-year-old, it's a male, and typically the elastofibromas are in older females, so that doesn't quite fit. Also, this is very small and localized, where the elastofibromas are usually larger, and some of them can be really huge here and elevate the scapula. But since it is the classic location, they are having pain in this region, the posterior shoulder, I definitely mention that, and maybe throw in one more thing like maybe a hemangioma could have these same signal intensity characteristics. But I just want to throw that out there in case you haven't seen elastofibromas. I think I've seen just a couple or a few over the last couple of years. They're very, very rare, and maybe gone 8 years or so without seeing one at all. So thank you very much. Hope you have a great day.